EMS personnel have been raising the alarm bells for years on the crisis within emergency medical services. Here at The Standard, we've written a number of stories and columns exposing the extended and growing wait times for ambulance services across this province. The Health Sciences Association of Alberta has been posting daily red alerts in Alberta cities as areas find themselves with no ambulance services available. So, of course, what's finally happened, a woman in her 80s is bled to death while waiting over half an hour for ambulance services in Calgary. She was a mere 4 kilometers from the largest hospital in Alberta. According to Google Maps, it would have taken less than 10 minutes to drive her to that hospital in a car. An ambulance, presumably, would be faster. And speaking to a paramedic in Calgary familiar with the incident, he's heard that this death would almost certainly have been prevented had there been timely trained medical intervention. Bystanders waited helplessly as a woman slowly faded away in front of them, and the minutes ticked away since calling 911. The problems plaguing Alberta's emergency medical services under AHS management are many. There's a lot of factors. The big one yesterday, though, the largest contributing factor to the death of that woman in Capitol Hill, Calgary, was the usage of paramedics for hallway care in hospitals. At any given time in a large Alberta hospital, you'll see half a dozen or more ambulances parked in and around the emergency area. If you go into the hospital, you'll see upwards of a dozen or more paramedics hanging around caring for non-critical patients in the hallways and waiting rooms of the facility. They're not allowed to leave until hospital staff sign off on a patient, so they're trapped there. And hospital staff find it easier upon themselves, of course, not to sign off quickly so they can dump the care upon the paramedics. This leaves paramedics stranded while cities run out of available ambulances. With AHS now running the entire show, it's centralized. It wasn't that way in the past. They cower in terror, of course, of public service unions. They don't want to raise the ire of the nurses union by taking away the hallway care given by paramedics. So they look the other way, despite the paramedics union calling foul for years. The bigger union wins in the end, and citizens are the ones paying the ultimate price. Had paramedics been allowed to leave Foothills Hospital last Sunday, they likely would have arrived to the scene where that senior was dying and gotten her back to advanced care in time to save her life. Instead, I imagine they were sitting helplessly in a hospital, watching patients with non-life-threatening conditions. The dispatch service can carry some of the blame here as well. In case you were wondering, if you didn't know, if you call 911, the operator is not allowed to tell you how long it's going to be until emergency services arrive. You can ask and ask. They won't tell you. This has been a problem all over the system. A case in Okotoks led to firefighters staying on the scene of a serious injury, waiting for nearly an hour for an ambulance. Had emergency services simply told the firefighters how long it would be, they could have transferred the patients themselves. Instead, the person's life was put at risk, and trained firefighters were unavailable to respond to any fires that might break out. All they needed was to be told. Time is everything in emergencies, whether medical or with fires. The longer one waits for trained responders, the higher the chance of a negative outcome. This is common sense, but that's always lacking when it comes to big bureaucracies. Had bystanders attending to the dying senior known it would take over half an hour to get an ambulance, they may have chosen to drive the woman themselves. Or, with enough fit people, they could have carried her to the emergency room in less than half an hour from that location. Hell, they would have been better off calling an Uber. At least ride-sharing apps will let you know how far the car is away from you. Uber does a better job than our bloody ambulance system. All we can do now is hope that this tragedy acts as a wake-up call. AHS has ignored every other alarm to date. So it's hard to tell if the needless death of a local senior will be enough to make them take action. Unless things change dramatically, though, and soon, it won't be a matter of if another person dies waiting for an ambulance. It's going to be a matter of when.